Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story, and today we are looking at calcium deposition and joint pain, something we see more often than many people realize, yet it is frequently misunderstood at home. That's why our team looks at it from four perspectives: what the doctor evaluates, what the pharmacist safeguards, what the dietitian supports, and what you at home can manage day to day. This is your nursing perspective. There is a way this condition often begins. Quietly, a joint starts to hurt, maybe the knee, the wrist, or the ankle. There is some swelling, some stiffness. At first, it feels like a strain. You explain it away. Maybe I overused it. Maybe I slept on it badly. And sometimes it settles. But then it comes back, and this time it feels different. The pain starts suddenly, the joint becomes swollen, sometimes warm, movement becomes difficult. Then it improves again, but after a while it returns. And that is how the pattern forms: sudden pain, swelling, recovery, then recurrence. At first occasional, then more frequent, then harder to ignore. At that point, it is no longer just a simple joint issue, it is a pattern. From a home care point of view, the first step is simple. Observe before you react. Pay attention to which joint is affected, how suddenly the pain starts, how long it lasts, whether swelling is present, how often it repeats, because patterns often show up before a diagnosis is made. Now, let's understand what may be happening. In some cases, calcium begins to deposit where it should not be. Instead of staying in bones, it collects in the joint. This is what we refer to as calcium deposition, sometimes called pseudogout. These deposits irritate the joint, and the body responds with inflammation. That is what causes the sudden pain, swelling, and stiffness. But there is another layer. Calcium changes are not always limited to the joints. They can also affect blood vessels over time, leading to stiffness in the vessels. So what looks like a joint problem may also reflect a broader system change. Now, let's talk about what you can do at home. When a joint becomes painful and swollen, rest the joint, avoid unnecessary movement. Apply a cold compress to reduce swelling, gently for short periods. Support the joint, elevate it if possible, stay well hydrated, and be careful with repeated self-medication if episodes keep returning. Now look beyond the moment. Ask yourself, is this happening more often? Is it affecting different joints? Is recovery taking longer? Because repeated episodes are not random. They are signals. And here is something important to remember. Relief is not the same as resolution. The pain may go, the swelling may reduce, but if the underlying deposits remain, the cycle can continue. So think like a nurse at home. Track the episodes. Notice the pattern. Watch how it changes over time, because the pattern is the message. Now know when to seek medical care. Do not wait if you notice frequent or worsening joint attacks, severe swelling and pain, difficulty moving the joint, fever with joint symptoms, multiple joints involved. These need proper evaluation early. Now step back and look at the system. Calcium balance affects the body. Joints respond to deposits. Blood vessels reflect long-term changes. Metabolism influences all of it. Everything is connected. So the key message is simple. Do not ignore repeated joint pain. Do not assume every swelling is just a strain. Do not rely only on temporary relief. Observe patterns, support the joint, and seek evaluation when it repeats. Because early attention prevents long-term complications. Remember to explore the other three perspectives: doctor, pharmacist, and dietitian, because each one completes the picture. Need guidance? Contact your healthcare provider for proper evaluation, or call or WhatsApp +233 20 872 0347